Hi, my name is Brenda Bastanzi. I'm coming to you from Santa Fe College, and I'm in class HIM2810, and I will be discussing long-term care. What is long-term care? Long-term care facilities are typically known for having elderly patients, but they can also serve as skilled nursing facilities which house rehab, occupational therapy, and speech therapy. It is 24-hour care. The different departments in long-term care facilities work together to provide overall care of the patient. A long-term care facility is a facility that helps people of any age versus at home. Assistance is 24 hours with meals in a home-like setting, which includes eating, bathing, dressing, toileting, taking medication, transportation, laundry, and housekeeping. A lot of the times a patient will come in with a situation where they need rehab and can't get the help they need at home, or do not have the ability to perform certain tasks like cooking, and the facility will help provide occupational therapy to get them back on their feet. Or the patient may not be mobile and needs help with rehab to become mobile again. Or the patient can use the limb that they have lost mobility in after rehab. Or maybe they lost a limb and have to relearn a new way to use their body to overcome the missing limb in order to go back home. A long-term facility can also be a place where the elderly live because they can no longer take care of themselves for the rest of their lives. They may need help with medication, or they may be in a wheelchair and can't get around at home anymore without assistance. The elderly patient may not be able to use the toilet anymore, and having a certified nursing assistant will help with that. Their meals are taken care of and made for them too. Often choices are made for the patient when it comes to living conditions, with just a few of the patient's things being brought in to set up as a temporary home until the patient dies there. Sometimes, however, patients do end up overcoming their conditions that put them in the hospital and they go home. Long-term care facilities have patients who have certain conditions in which they care for their patients that are no longer needing a hospital but can't be released into their home. Such conditions may be like somebody who has a brand new gastrointestinal tube for feeding, a new diabetic insulin dependent, somebody who has IVs, and wound care. These conditions require nursing care at the long-term care facility, and the reason this is better for them than a hospital is because it saves money. It's the go between the hospital and home. Admission to long-term care. A long-term care facility has a nurse liaison that goes to the hospital to do an assessment and decides whether or not they're fit for admission into a long-term care facility. Sometimes he or she may say that the patient may need an assisted care facility. Some of the criteria for getting an admission to a long-term care facility when on Medicare is that the patient must have a 3-night stay at a hospital before they get accepted in order to be covered 100%. Other criteria can be that the facility must meet the patient's needs. A patient could be turned away from this facility if they need less care and where they can take care of themselves better than the rest of the patients. Also, clinically, if the nurses don't have the skill set to take care of them and they need a higher skill set, then they can't be admitted. It doesn't happen often, but periodically. After the nurse liaison decides on admission and evaluates them with the paperwork and assessment, it goes back to the director of nursing to see if the nurses are qualified to take care of the patient. In the end, the nurse will have the final say. Then the medical records department makes a chart to make sure the patient is ready prior to admission for the patient to bring them in. An example of a long-term care facility is Solaris of Lake City. It is a 120-bed facility. The type of patients they accept are private pay, Medicaid, Medicare, managed care, private pay, and hospice. They interact with the following departments: nursing care, rehabilitation, occupational therapy, and speech therapy. The STEP rehab is their signature service, provided to bring a safe transaction home. Some of the nursing care that they provide are wound care, IV antibiotic therapy, medication management, diabetic management, and education. Federal and state regulations. MDS is a federal regulation with long-term care, also known as the minimum data set, and it requires an estimate at the days 5, 14, 30, and annually, and it's what drives reimbursement for the patients. Some basic needs for the patients are also 3 meals a day plus snacks. Some long-term care facilities have skilled nursing care, and the MDS has to be done by day 14, and the care plan must be done by day 21 for skilled nursing. But by day 5 is the HIM department's responsibility. The MDS is the assessment, and the care plan is what identifies the problems and how the facility is going to address them. Depending on whether the patient is skilled or long-term care will determine how often the patient is revised. MDS also requires that you find alternatives to bed rails. You're not allowed to restrain the patient because the facility can't tie them down. Documentation requirements and guidelines for the setting. The first thing that is going to tell about the patient, this is the first thing that's going to tell about the patient and be put into the chart, is the admission plan and assessment. The things found in the assessment are vital signs, weight, limitations, and what are the patient's daily activities. What do they do around the house? What are their extracurricular activities? Do they like to read, play cards, or go outside? What kind of diet are they on? It could be restricted to a diabetic diet or some of the restricted diet. The admission plan will list their religion and if there are any recent falls. The nurse and MDS coordinator will use the information, and the nurse will be the biggest part of care and will coordinate on the assessment with the MDS coordinator. The care plan will be next, and it is mandatory for every patient to have one. It lists problems that may be related to diagnosis. For instance, any falls or risks of falls is a big long-term care concern and must always be coded. They, for instance, could have falls because of a CVA and must list your prevention methods and your goal that would reduce the falls. All disciplines deal with the care plan. The care plan is written by a nurse at first, and then the MDS does their assessment. Therapy also does their care plan, and the dietitian does their dietary care plan, and the activities director does their activity care plan. The MDS must be signed off regularly by each department for their portion of the care plan. On release of information, you must have the name of the physician, who it is for, disclosure, authorization to use and disclose, name of the patient, their address, the dates in which the information is needed, and the reason for the request. Most requests are for 30 days out unless they're going to be seen within several days of their primary care, and then the HIM department must get the requests out sooner. Privacy on Facebook is also an issue as well. Staff can't post pictures on Facebook of the patients because it is a HIPAA violation, but there is a waiver for their business site. The business site can post personal pictures of patients on a business page. Everyone in their department monitors Facebook for HIPAA violations, and every family member can't post pictures on Facebook. The facility also looks at abuse for the posting of pictures and considers it a violation of the patient's dignity. Abuse can be verbal, physical, or dignity. Another documentation requirement is that upon admission, a chart must be set up, which is done by the HIM department and medical records. The chart consists of HIPAA consent, an inventory sheet of what the patient brings in, billing, consent to treat, and it lists what type of patient they are, whether Medicaid, Medicare, or hospice. A white label is Medicare, a pink is Medicaid, red is hospice. It stays in the nurse's station with a room number and states whether or not they are at risk for falls. Reimbursement and funding issues. There are 5 ways that a long-term care facility gets paid. That's Medicare, Medicaid, managed care, hospice, and private pay. Medicare is paid 100% for the first 21 days, and day 21 is a copay. Patients who are doing well or motivated are out before the 21 days because they don't want to pay the copay. And Medicare pays the 10 days per year, even then there is a 60-day break. And patients will sometimes go home and struggle for 60 days and then end up in the hospital after 60 days is up, and the process starts all over again, and they're required a 3-day hospital stay again. Medicare patients also need supplemental insurance because of this break in reimbursement. Some of the qualifications of readmission are no trachs because they need a respiratory therapist. However, when the census or number of patients gets low in the facility, it will loosen its standards and take a trach patient. A psychiatric diagnosis is needed because long-term care patients are not taken on as suicide patients or on suicide watch. The stay for hospice is a couple years, and hospice recertifies every 90 days, or if the patient is going to the hospital too much. Some of the qualifications for hospice are a life expectancy of 6 months or less, multiple comorbidities, frequent hospital visits, decline in daily activities, falls, and decline in cognitive function. The facility must educate the patient on when they could die, but the family could still be in denial. When the insurance company is looking at reimbursement, they look at therapy notes, wound treatment, physician progress notes, and hospital paperwork. CMS will use the MDS to gauge payment, and MDS drives the Medicaid payment. The facility gets a certain amount of money for each Medicaid patient, and the MDS determines how much the state is going to pay for Medicaid per day. Even if the cost is more, you only receive what Medicaid pays. Managed care is looking at getting pre-authorization. The managed care plan will approve care for a certain number of days, and then you have to go back and get authorization to keep a managed care patient, and the company will want to know why. This is why long-term care doesn't have a lot of managed care patients. With managed care patients, you also get a certain allotment. Let's say the insurance company is going to give you $450 per day. You have to work within that so you don't go over. Certification, licensure, and accrediting agencies. Long-term care is Joint Commission accredited and has to have initial certification review, and then they come back every 2 years. The Joint Commission is looking for physician compliance, competent staff, rehospitalization rate, and the credentialing process that the annual reviews, almost like another state survey. The American Healthcare Association is reported to also for grievance, abuse, or neglect, and AHCA will do an investigation if necessary. Long-term care facilities also have state surveys that look for compliance from every area of the facility, including dietary and the kitchen. Nursing must have their certifications to be RNs, and the physicians as part of their certification as well. Federal and state regulation citations. The Nursing Home Reform Act was put into place due to an abundance of neglect in 1987, requiring nursing homes participating in Medicaid and Medicare to participate in certain quality of care rules. The Act states that nursing homes must provide services and activities to maintain or attain the highest level of physical, mental, psychosocial well-being of each resident in accordance with the written plan of care. Sufficient nursing staff conduct initially a comprehensive and accurate assessment of each patient's functional capacity, develop a comprehensive care plan, prevent the deterioration of a resident's ability to bathe, dress, groom, transfer, ambulate, toilet, eat, and to communicate. Provide, and if each resident is unable to carry out activities of daily living, the necessary services to maintain good nutrition, grooming, and personal hygiene. Sample policy and procedure for creating a new record. Admissions will put in all the basic demographics like name, date of birth, and when they are physically in the nursing building, they will do all their assessments. The next day, the HIM gets all their hospital paperwork, consents, and then they get a medical record with a ledger to keep track of what number they are on. Coding schemes. When coding for long-term care, you use ICD-10-CM, not PCS because there are no surgeries. Coding in long-term care facility is different than acute care facility. You code from the hospital report, but you don't code the whole report, and you don't always have the same admitting diagnosis. For instance, if you read the hospital report and you see the patient went in for cabbage, you won't code that for that. You would code the aftercare of the circulatory system. It would be the hospital's job to code for what brought the patient in for the cabbage, but that should be resolved. A lot of the time, you have to know what would have resolved at the hospital, and you really have to know what the long-term care facility takes and doesn't take as far as patient care. You may also have to look at labs to check and see what the bug is for a UTI, or check the medications to see if there is any long-term use of aspirin, anticoagulants, or insulin. You also are coding a history of falls a lot. This is very important to put in the documentation because the care plan would need to address the issue. You also have, in long-term care, other departments than code. Sometimes the HIM director may not code the dysphagia because rehab will be more precise in their coding of what type it is. This is another way in which you don't code all of the hospital record. Nursing is also going to code, and they will code a lot of the conditions with their medications and new diagnosis. The MDS coordinator also codes. You could also have a patient that was a hospital patient that had a wound but ended up with an amputation. You would not code the wound because it would no longer be there. You would code encounter for aftercare following surgical amputation. You can code a history of mastectomy because this helps with vital statistics and CDC tracking for research. Overall, I would say long-term care facilities really look at all your needs. They try to get you the best care and get you back on your feet with their assessments and care plan. They prepare the way for you to get back home or make the facility as homey as possible. You definitely want to pay attention to what kind of insurance you can afford as you get older to get the best possible care and take care of yourself throughout your elderly years and stay healthy. Thank you. This is Been a pleasure.